Let's talk about FIV. Let's talk about you and your kitty. Hey everybody, Amber here with Attaboy Animal Care, Pet Sitting and Dog Walking, located in Lakeland, Florida. Today I'm going to be talking to you about FIV, or sometimes known as kitty AIDS. I'm going to talk to you about what it is, how is it transferred, what kind of prevention or vaccine is there, and how do I know if my cat has it. So if you're interested in that, less than 10 minutes, let's keep listening. So first and foremost, FIV, feline immunodeficiency virus. It is a virus. It is related to or similar to HIV in humans, but humans can't get it. No other animal can get it except F for felines. So you're good. So what is it exactly? It is a virus that is transmitted to felines from other felines, or cat-to-cat transfer. It is immunodeficiency, so it decreases the immunity of the cats that do have it. Now, let's talk about how is it transferred. Most commonly, it's transferred by saliva going directly into the bloodstream of another cat. So a cat that has it can usually bite another cat, a deep bite, and then that saliva that's carrying the virus goes straight into the bloodstream of the other cat. And then, ta-da, that cat can potentially get FIV. Other ways it's transferred, from a pregnant mother cat to her kittens when they are being delivered, or potentially when they're drinking her milk as well, or a blood-to-blood like transfusion or transfer. So infected blood going into an uninfected cat's bloodstream as well are the most common. Now you're going to ask, when does a cat bite another cat that they can get FIV? Well, most commonly it's for outdoor kitty cats, most commonly male, intact, that are territorial cats that are fighting another male cat, typically bite each other, boom, FIV. Or it can be of a more of adult nature when one feline falls in love with another feline, and during that intercourse process, the male cat will commonly bite the back of the neck of the female cat. Don't try that at home. And then FIV could be transferred that way as well. It doesn't live long in the environment. It doesn't live well on fomites or inanimate objects to carry it. You can't usually transfer it through food bowls or water bowls, etc. So the most common cat that is susceptible to FIV is an outdoor cat that has potential access to other cats that are outdoors as well. Our indoor kitty cats, as long as they don't have outside access, even if supervised, they don't go outside at all, very low risk of ever getting it, because they have to have another cat bite get them. Now, another way is if you have another cat in the household, they get in a riff and then have a fight and then bite each other. Now you're going to ask me, well, Amber, how do I know if my cat has FIV? Well, great question. Your veterinarian has a test for that. Actually, a couple of tests for that. One of the most common, blood test, usually can be in-house. They take a blood sample, they put it on a test within 15 minutes or so. It'll tell you if your cat has FIV or FELV. You'll commonly hear this from your veterinarian's voice of when they're asking for your annual, if your cat needs a leukemia or AIDS test, or if your cat has FIV or FELV testing as well. That test can be done on a yearly basis or more often. Most commonly, your veterinarian will ask if you want to have the FIV, FELV test done, and if your cat has any outdoor access whatsoever that could potentially come in contact with another cat, yes, they should have that test. Usually less than $50 once a year, usually in-house, sometimes get sent off to the laboratory. And then you'll know if your pet has FIV or FELV. If you don't know what FELV is, check our previous video that's in our videos tab of our Facebook page. So with that said, okay, Amber, I know that my cat could potentially get it from other cats. I know I can go to the veterinarian and get a test for it to check if my cat has FIV or FELV. FYI, if you think your cat has been potentially caught that FIV virus from another stray cat, it can take up to 8 weeks to show positive on a test. So just because your cat may have gotten in a riff with another cat, you may have to wait up to 2 months to get that test checked to see if they actually have it, to actually show a positive on the test. So what can we do? How can we prevent our cat from getting FIV? 1, keep them indoors. Straight up. That's simple. Okay, so if you're an indoor kitty cat, keep them indoors. They can't get in contact with another cat. They can't get FIV. Okay, my cat's outdoors. What do I do? Well, not much. There used to be a vaccine from like 2000, early 2000s to 2015 or 16. It was the FIV vaccine. You'd get a couple boosters as the first time dose and then yearly after that. But it got pulled off the market in 2015. Now here all the anti-vaxxers are coming in going, I told you vaccines are bad. Now listen, this is why. There's 4 main reasons. First reason is it was not very well sold in the veterinary clinics. Okay, straight up. Most veterinarians have to buy a pack of say 25, and then they would only sell 1 or 2 occasionally because people that brought in their outdoor kitties and then actually wanted to pay the cost for the vaccine were rare. So it wasn't cost effective for veterinarians to keep it. 1. 2. It only covered certain strands of FIV. So if your cat got exposed to other strands of FIV, kind of like the flu virus, you're still going to get FIV. 3, remember how we talked about some vaccines can cause localized vaccine cancer reactions potentially? Yeah, it can happen. It's not common, but it can. Well, with the FIV vaccine, the more often the cat got the vaccine, the higher probability that this sarcoma of that vaccine site could potentially happen. So that got pulled off because of that as well. So ultimately, there is not a vaccine for FIV effectively in the area because of not commonly used, the potential cancer site area of the vaccine, and then the fact that it only covered certain amounts of strands of the FIV. Oh, and last but not least, when your cat got an FIV vaccine, they would test positive for FIV henceforth on testing. So if your cat ever got loose or had to be adopted out and it got tested and they thought it was FIV, they would euthanize it because it's really hard to adopt out FIV cats sometimes. So many places will euthanize FIV positive cats. So if your cat got loose, it was FIV positive, they didn't know their vaccine history, boom, your cat could potentially get euthanized, and nobody wants that either. So if you have any questions, let me know. But again, FIV, feline immunodeficiency virus, similar to the human HIV concept, can transfer into a concept called feline AIDS, which is acquired immunodeficiency virus, but it's not the same. Humans can't get it, dogs can't get it. Other animals and the cats in the household could if they got in a fight situation where blood was transferred or saliva to the blood was transferred as well. There is no vaccine for it. There is no cure for it. And the worst part of this FIV situation is because their immunity is lower. Ultimately, they're more probable to get other secondary infections or their typical viruses or bacteria infections that they may get, they're not going to handle as well. So they sometimes can have a higher rate of dying from more common situations. They also tend to have a lower life expectancy because of that. Oh, last but not least, can my cat have leukemia and AIDS? The answer is FIV and FEL. So, with that said, lo and hold, if you want to keep your kitty away from FIV, keep them indoors. If they're going to be outdoors, get that annual testing to check if they're getting FELV or FIV potentially from other outside kitty cats. Have a great day, guys. And remember, Attaboy Animal Care, where we always say, happy pets, happy people.